Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them.
You heard him correctly. Florida's Surgeon General announcing today the state is pushing to ban vaccine mandates across the board. This would make Florida the first state in the union to end the long-standing practice of requiring certain vaccines for students. Meantime, here on the West Coast, Governor Bob Ferguson is teaming up with Oregon and California to form a coalition to establish their own vaccine recommendations. This move coming in response to what they are calling the Trump administration's dismantling of the CDC's credibility and independence, adding the center has become a political tool. Joining us tonight to discuss is pulmonologist Dr. Vin Gupta, also an NBC News medical analyst. Thanks so much for being with us.
Thanks for having me, as always.
So, of course, we want to get your take on both of these vaccine policy stories happening today. First, here at home, what is the significance of this multi-state approach that Governor Ferguson announced today?
Well, Joyce, it's a reflection of the CDC and what's happened over the last 6 months, but especially the last 2 weeks. It's been, we use this word all the time, unprecedented, but truly there's really been never before this blurring of science and ideology as we've seen with this new administration. So it's important. And I'm glad they're doing it, because right now it's been on medical societies like the American Academy of Pediatrics, who I work closely with, to put out counter information that's more consistent with the evidence. So I'm glad that these governors are doing it. It's going to get momentum that's needed to really counter what's happening at the federal level.
One of the objectives has to do with coordination, just in case we see any kind of outbreak. So explain how that could help families here in Washington in a very practical way versus our state acting alone, independently.
I mean, exactly to your call out, Joyce. I mean, we're talking about the entire Western Seaboard, multiple ports of entry, both international, domestic. And so what happens at those ports of entry, sometimes in the passage of infectious diseases from places afar, from places even close to home. And so it's important to have that data sharing, not just limited to what we're seeing here at the borders and ports of entry in Washington state, but as much as possible across the country. That was the whole point of the CDC. It was one of its critical functions. Leaders that were overseeing that, the Center for Zoonotic Diseases, they just resigned last week. It's entirely rudderless. And so it falls onto these large states to data share, to say, what are we seeing when it comes to COVID cases? Are there new variants? What about flu? Is there something new out there, Joyce, that we haven't ever seen before that we need to be paying attention to? But working together is by far more optimal, so we have more data to look at.
You're a parent, I'm a parent. I was listening to the news this morning. I was thinking, what is happening? As I heard the news coming out of Florida, which, as you know, is now pushing to ban all vaccine mandates, including school vaccine requirements. We're talking polio, measles, mumps, possibly even chickenpox, hepatitis B, HPV. When you see what's coming out from that area, from Florida, from the Southwest, as a public health perspective, expert, what does it mean when you see Florida doing this? How are parents supposed to navigate really conflicting messages?
I'm going to get to that last part towards the end. What I'll say is up front, this is not what the strong majority of Americans want, Joyce. 80% of Americans, bridging our political divide, few things get 80% support in this country nowadays. 80% of people, per many public surveys, support vaccine mandates for children, especially in some type of congregate setting like a daycare or a school. This is not controversial. So what happened in Florida earlier today, I hate to say it, it's performative politics. Their Surgeon General is playing into it because he often has a history of doing that. So this is nothing about patients. This has nothing to do with the Hippocratic Oath. This has everything to do with, frankly, just playing to politics. And I think that's the problem here. And so, but when it comes to what is a trusted resource, the most trusted resource that I'm utilizing, I know many are utilizing, is healthychildren.org. This is actually produced, Joyce, by the American Academy of Pediatrics. It's navigable, easily discoverable information, has all the information you need for your child when it comes to, what vaccines you get come the fall. So the healthychildren.org is a purely nonprofit. And then for adults, if you have questions, go to immunize.org. great resources here, but ignore what's happening in Florida to the best extent that we can, because it is not emblematic of the country. It's wild what's happening there. And the Florida Surgeon General should be, frankly, I have to say it, should be embarrassed of himself. He's sycophantic. And this is, frankly, I mean, when it comes to scandals in health, it's scandalous what they're doing down there, because it's not about substance. And it's not even about what the people want at scale.
Well, as a physician, we'll have to talk with you. We're out of time now, but I'm just curious if you've ever seen a time like this in your career where such opposing messages are coming from our government, from various states, with coalitions of states having to band together to protect our kids. Ever?
No, this has never happened. We're in uncharted territory.
For next time, Dr. Vin Gupta, we so appreciate you joining us and your expertise. Thanks so much.
Thank you.